So we are sharing this case of PALMAR psoriasis. She was having this psoriasis since many years and was under our treatment for over 2 years. And with the partial results that she had, um, she would always stick to us, only you are the one who can take care of me, and I don't want to go anywhere. That was a kind of a dependency that she had on us. For certain things about her nature and about the complaints that she has, she used to describe this as if I'm suffering where Jesus was nailed. He was nailed in this position, so I am also suffering with on the same region. Okay, I'm sharing the Jesus pain. Jesus talks to me, and I can feel his pain. How unbearable it is. Hmm? So she feels that the Jesus is sharing this pain with her, and he sacrificed himself for her. So much of religious affection that she had. He is everything, and I will take this pain for him. And then we saw the eruptions in complete repertory under the extremity sections, eruptions, psoriasis on palms. There was a the mark remedy was phosphorus, which was 4 marks.
Only 30 remedies in this, yeah. So sometimes if your the peculiarity is of where that particular ailment is. So the location was very peculiar and the patient was stressing on the location. And if you see in the repertory, there are only 30 remedies, out of which phosphorus was the highest marks.
Yeah, and so we repertorize it with the religious affection themes. Also, fear of suffering that she had and described, and the clinging part of her, clinging to the God, clinging to the doctor, and to whom she can completely rely on. And when we repertorize, we see there are few remedies which were coming, but phosphorus was coming very marked. And then we compare that with her physical complaint. So we were
her entire being, yeah,
yes.
Not just the physical complaints, which exactly matches. And I also want to kind of emphasize here, it's not just clinging as the rubric. Clinging on whom? Clinging takes even the hand or any part of the mother will always. This is absolutely childlike dependence. Clinging on the mother, no? The God is like mother. The doctor is like the mother. Who is mother? What does mother symbolize? Mother symbolizes
the unconditional love.
Unconditional love, complete dependence. And that is the crux of this lady and phosphorus in general, yeah. So repertory really worked in this particular case, and if you see the results,
yeah,
and this was in how much time?
Yeah, immediately. I think within 15 days, this was the result, and miraculously, it treated her.
She's very, I mean, she had all the other phosphorus features, no? Lots of talking, even to an auto rickshaw driver, she would talk a lot, communication expansive, all of that was there. But the crux, I think, was on the importance of the location and then mapping it with her overall personality. We'll share one more case. This is a case of a young boy, 4 years, roughly 4 years and 10 months, close to 5 years, and he was diagnosed with autism. And the mother said that he started withdrawing after the younger sibling was born. Okay, when the patient was roughly around 2.5 years old. And clearly the mother described that this child, the patient of ours, did not like the younger sister. Did not like her sounds also. He would get irritated when the younger sister would cry, and he would get really jealous when the mother or the family gave all attention to this younger sibling. This patient was cranky, restless, would cry and shriek loudly, keep moving all the time, had no eye contact, and he was extremely scared of loud noises, even the whistle of the pressure cooker or the vacuum cleaner or hair dry, all of that would kind of really scare this child. But he was very intelligent, toilet trained, and when he would be angry or when he wanted to express something, and if he couldn't, that would really make him very angry, and he would start throwing things. Hmm? Another peculiar thing about this child was that he had a voracious appetite. He would really, really eat a lot. Sometimes he would wake up in the middle of the night and ask for food. So much was the hunger. And that also tallied with the mother's history during pregnancy. This family is basically somebody who is an Indian family who went to the US and settled there. And she got pregnant when she was in the US. She was all alone because the entire family was here in India and the husband would go to work. So she was so alone, so lazy. And then she would feel this lack of family and lack of support system or love with food. She said, I ate a lot. I had a ravenous, insatiable appetite during pregnancy. So this is the very short history of the case. And what was the peculiar thing? The mother said the child started regressing after the birth of the sibling. So just in the reference work, if you put birth and sibling,
In the same remedy.
in the same remedy or in the same sentence, actually only 5 remedies come up: Baraita carp, ignatia, sacrum album, and sepia. Okay, 4 remedies actually, not 5 remedies also. And then this is so peculiar. This child was intelligent. This child did not have that ignatia quality, did not have the qualities. Even the mother's history did not have ignatia quality. The mother was not indifferent. The child is not indifferent like sepia. Didn't have the soul of sepia for that matter. Sacrum album came up. This is a monocotyledon and it comes up in this reference work. When we take other rubrics, restlessness, jealousy, appetite, which is insatiable, okay, and even then if you see here, sacrum album comes. This child also had a desire for warm drinks, with desire for tea. So beautifully, this sacrum album, people who practice the sensation method, or people who practice the personal evolution method, people who have followed the method of Yakir, we understand monocotyledons and we understand sacrum album much deeper. But even using the basic tool of repertory, something like that comes up and you can tally it and you can connect all the dots of the case, and the case really opens up. This child beautifully responded, more than 80-85% within the first 2 months, okay, and developed more understanding, became more independent. His running around, restlessness, spitting, his shrieking, violent trait went down. He really, really, really improved with Sacramento. Prajakta and I wanted to just share these few examples of how repertory helps in case solving and opens up this beautiful world of remedies with us. Yeah, we are doing this repertory intensive series where we're going to take a deep dive into rubrics, understand rubrics, give you case examples in which we'll understand how to use repertory, when to use complete repertory, when to use the Bonning-Gausson's repertory, when to use reference work, and how to use repertory as a tool in acutes, how to use repertory while understanding the mind rubrics, and how to explore single remedy rubrics. We're going to do this along with Dr. Arshi and Dr. Kushala, who themselves come with such vast experience. So come join us. All the registration details you'll find in the description below. Look forward to seeing you there.
See you.
Bye-bye.